as related to their disease burden and their hospital capacity. A team of medical experts and decision makers from each of our local health systems is working together to produce a detailed plan on how to increase capacity within our existing hospitals. As the mayor mentioned, this involves maximizing the number of hospital beds, the number of critical care beds, and the number of ventilators available for patient care. Our health systems in Milwaukee County are working side by side at the highest levels, collaborating on a constant and ongoing basis, sharing resources and information to better ensure that we as a community are prepared. Meanwhile, our Unified Emergency Operations Center is going a step further to identify facilities that could care for patients should we need to go beyond the capacity of our hospitals. And Chief Cohn will speak more on that effort. But we are laser focused on our work to prevent a situation of overwhelmed hospital capacity that we are witnessing in places around the world. Thank you very much and stay safe.
We have Ann up next.
Yeah, so hi, thank you for having me. I'm Ann Christensen. I direct the North Shore Health Department, which serves the 7 communities from Brown Deer down to Shorewood in the northern part of Milwaukee County. And I'm just speaking on behalf of the 11 local health departments in Milwaukee County to share our message about some of the things that we're doing on that population level. So just a little bit more situational awareness. In the North Shore area, we have 48 confirmed positive cases of COVID-19. And we had a press conference on March 13th where we were reporting 1. So we're seeing the impact of COVID-19 in our communities as well. Certainly the tremendous burden of cases seems to be the city of Milwaukee, but again, all of our communities are experiencing cases. And to remind everybody that with a public health situation like this, everybody is in this situation together. So one of the things that we do in public health is work with those who've been identified as COVID positive and try to understand who they've been around and who their contacts might be so that we can then notify those individuals and then determine what risks they have of getting the virus and recommend quarantining for 14 days if that's appropriate. The reason that we do this is to create a circle around those individuals to prevent further spread. And one of the things that we're seeing here in the North Shore is with these social distancing measures in place, that the number of people that have been in contact with our cases does seem in this early stages to be shrinking. Not saying that that's kind of the end of this story, but it does give us a little bit of sense that the social distancing measures that have been put into place are making a difference with regard to the number of people that have been exposed to those cases that we're seeing more recently. So that's a story that we're going to continue to watch and use for additional information about these measures. I think my last kind of point is, again, around social distancing, in that in this pandemic, we really are all in this together. It is not a story of the city versus the suburbs versus other places around the state. It is something that social distancing and physical distancing measures need to be done by everybody in order for to work. They can't just be done by half of the population. So really, if we want our kids to get back to school, if we want our lives to get back to business as usual, please listen to those messages about stay safe, stay at home, and limit any time outside to essential activities like going to the grocery store and running those types of errands. So that's the public health message, and I'm happy to take questions about what we're doing at the local level after the briefings.
John.
Sorry, I think you called on me. Good afternoon. John Cohen, Fire Chief for the City of Greenfield. Also serve as the president of the Milwaukee County Fire Chiefs Association, and also work with the Unified Emergency Operations Center that Dr. Weston talked about. Just want to briefly describe some of our actions and what Dr. Weston referred to. But first and foremost is the safety of our members. Our members can't protect the public if they aren't safe. And this is really challenging at this time. As you've seen on TV before, we're asking our first responders and healthcare providers to use disposable equipment that is meant to be disposable over and over again. So we are in a challenging position. Great kudos goes to our members that they understand this guidance and they're using it responsibly because they realize that if we don't use it responsibly, there is no supply chain and we will run out and we'll be unprotected. Another thing that we're doing actually to also sort of try to decrease the footprint of the personal protective equipment that we need is we've come up with a regional response plan. It was spearheaded by the City of Milwaukee Fire Department and is participated in by all suburban fire departments in this regional response plan. So we have created response units that will go to certain call types and address COVID-related emergencies. That has streamlined the process, put some providers that are very focused on these calls, that are very good at making assessments and determining the next course of action for treatment. That is one of the attempts at also conserving PPE because they're really good and focused and know how to manage these patients that hopefully take some of the pressure off the system. So it's likely that you could see a Wauwatosa paramedic unit on the side staffed by somebody from Franklin and somebody from Cudahy. Members are riding together to staff these regional response units strategically located throughout the county. We are continuing to monitor those numbers regionally as it impacts emergency medical services. We have a plan to scale up with the expectation that we will continue to see a rise in patients. And we're continuously monitoring that to see if other units are needed and how we will best be prepared as those numbers potentially ramp up. As Dr. Weston mentioned, part of the Unified Emergency Operations Center is to sort of create that surge. We hope that it's not needed, but should it be needed, there's plans being made to make hospital facilities essentially outside of hospitals, where you see in other communities, they're bringing up field hospitals. So that's currently being worked on through a collaboration of hospitals, Army Corps of Engineers, and the Unified Emergency Operations Center. We finally, we hear a lot from the public. What can we do to help? The mayor mentioned if you have PPE supplies, there's still a donation site at State Fair Park. What more can you do? Wash your hands, cover your sneeze or your cough. Stay at home if you're sick. Stay at home, period. If we can get people to stay home, we can slow the transmission of diseases and we can get out of this and get back to spring and summer, hopefully. But we really need people to stay home. As they're staying home, we want to remind people to make sure they have a working smoke alarm because people are more in their homes. I want to make sure of that. And also another way that we're asking the public is before they call 911, is this truly an emergency? We see a lot of calls to 911 that probably could be best handled by calling a physician, calling a nurse line, telemedicine, or going to a clinic. So before you call 911, slightly pause and ask, is this a life-threatening emergency? If we can control those emergencies, we can keep our units available for people that need our help during this increasing time where our services are in demand.
Thank you, Chief.
Thanks, Chief. I'll be brief. Just quickly, as you heard from Dr. Weston early on, most of the projections that are being done now show the surge peaking towards the end of this month. So, if you sense the increased urgency in all of our voices every time we say stay home, save lives, it's because as bad as things are right now, we have to keep them from getting worse, but they're going to scale up it's going to get worse before it gets better. We're also obviously working with the Army Corps and others on facilities. The Clare Hall, which you heard us talk about yesterday, already open. So is the Super 8, which was done and paid for by the state. And we're obviously a surge facility where they're looking at a bunch of different facilities. But here's the thing that ties it all together. our ability to manage and healthcare workers' ability to manage this surge is directly impacted by how seriously and diligently everybody takes staying at home and social isolation, avoiding the interaction, avoiding any kind of unnecessary contact, because again, it's going to get worse before it gets better. We have to follow this. It's as serious as anything that's come up. So we will, we've been pounding this point before. We will continue to pound this point going forward.